Great Day Live on WHAS11 is sponsored by University of Louisville Physicians.
It is all about your health today. Regular exercise can help you look better and feel better, but for some people, it's a vital part of treatment for a disease that affects 1 million people in the United States.
1% of those over age 60 are affected by Parkinson's disease. Many aren't diagnosed for several years, and next month, UofL Physicians host its annual Parkinson's disease symposium. Dr. Kathrin LaFaver is a neurologist.
Thank you for joining
and
us.
Movement disorders specialist with UofL Physicians. Glad to have you here.
Thanks for having me.
Okay, initial signs. What should people look for when they notice there's a change coming?
Well, usually when people hear Parkinson's disease, they think of tremor or shaking of the hand, but there's a lot more than that. So often people get more stooped over, have more shuffling gait, slowness of movements. They have trouble with handwriting. Handwriting gets smaller, troubles with buttoning or typing on a keyboard, getting their arms in sleeves. But then interestingly, there's also a lot of so-called non-motor signs of Parkinson's disease. And these are, for example, loss of smell and constipation. So things you don't usually associate with Parkinson's disease.
And sometimes it might take a while for it to be diagnosed or for some of these signs to come out?
Absolutely. I mean, the diagnosis sometimes does get delayed because people are not necessarily aware of some of these early warning symptoms.
And we're looking right here. So some of the signs, tremors or shaking, the trouble moving or walking. You said it could be like a little bit of a shuffling, stooping or hunching over, small handwriting, a soft or a low voice. Controlling these symptoms, is that getting easier to do, and are things that people can do to control the symptoms, help control them?
Yes, so we don't have a cure for Parkinson's disease, but fortunately we do have many effective treatments to really help with the symptoms, help improve the quality of life. And besides medications, there are other things that people can do. So exercise is very important. Physical therapy, speech therapy have a very important part in the treatment. And exercise may even slow down the progression of Parkinson's disease.
Now, we saw on one of those signs there, it said a masked face. What is that? I don't know what that is.
So basically, people might think that you are very depressed, or because facial animation just gets less.
Oh, okay. So there's just less of that.
Right.
Might not seem as vibrant with your. Okay, interesting.
Not as
And some of the things
expressionful.
you listed, though, could be things that are temporary, though, excuse me, through like fatigue.
Yeah,
You might get a false sign.
Yeah, so sometimes people might just feel the changes they're experiencing are kind of part of normal aging, or people might think they feel depressed because they're just moving slower, not as expressive, but these can be signs of Parkinson's disease.
And I guess we said the two probably most notable people we would know around here would be Muhammad Ali and Michael J. Fox.
That is true.
When you have someone like that who has that disease, I assume it helps as far as getting it more attention, and we learn more about it just based on who might have it.
Yeah, I mean, so there's a lot of research going on to really find out what is really the reason for Parkinson's disease, because in most of the cases we don't really know. So we currently have a study going on at University of Louisville we're actually very excited about. As I mentioned, lots of smell and constipation are often early signs. So we're actually asking people to give us samples of their blood, of the top of the nose and of the stool, and we're looking at inflammatory factors and differences in the bacterial flora, trying to find out what are really these very early changes.
Isn't that interesting? So smell and constipation might be the two really early signs of Parkinson's. I didn't know that.
And most people don't, and are very surprised to hear that. And of course, not everyone who has constipation has Parkinson's disease, but these are very common signs.
Yeah.
Check with your doctors, like we tell people about lots of things, too, for sure.
Right.
Thank you, Kathrin.
Thank you so much. Really nice to see you. The UofL Physicians Parkinson's Disease Symposium, to let you know, is Thursday, June the 18th, starting at 5 o'clock at the Jewish Hospital Rudd Heart and Lung Center. That's at 201 Abraham Flexner Way.
It's free. Registration's required, though. You can call 582-7654 or email that address you see on there, UofL Physicians at UofLP.org.
We'll be right back. Good job. Boy, that's interesting.
A sectional 2 accent chairs, a new lamp, a bed set.
At the mega sell-off at Furniture Row, you'll score more for less with savings up to 50% off store-wide.
The rug, a sofa table.
If you think all lawyers are the same, you've never been to Sam Aguiar Injury Lawyers.
Hurt in a car? Call Sam Aguiar. 877-CALL-SAM.
The
picturesque French Lick Resort plays host to one of golf's most prestigious events. The 2015 Senior PGA Championship presented by KitchenAid, May 19th through the 24th. Last season, Colin Montgomery claimed his first major championship. Who will be next to rise above the rest? Witness legends of the game competing